Dr. Feigl-Ding, we're seeing a flurry of government measures here in the United States. National state of emergency, congressional relief package, briefings from the president. But many are criticizing that the response is too slow, not far enough. What are your thoughts?
Yeah, this response certainly has been very much delayed because we could have ramped up our testing like South Korea has. South Korea doing 15,000 tests a day. We've had no testing for almost 2.5, 3 weeks. This virus has a doubling time of 6 days. So we've lost at least twofold, fourfold, eightfold in terms of containment of this epidemic. And that is where a lot of the criticism is. And a lot of the information has been very confused so far. And we really need to lock down the quarantine and the contact tracing and the containment around these epicenters. But we have not, because we've been driving literally in the dark without any headlights, without testing.
I'm glad you brought up the testing kits because it's such a big issue in this country. And we've really actually seen quite high infection rates for people who have been tested, haven't we?
Well, it's right now we're literally just harvesting and testing on the backlog. There are people who have such severe illnesses that we are very, very sure that they have these the COVID-19. What we need to do is get past this backlog, this 3-week backlog of cases, and then so we can test people who immediately develop symptoms and immediately we can test them and immediately quarantine. We're not on that frontier yet. We're still stuck just trying to play catch up. This is why until we have ramp up testing and can offer it the same day to anyone who develops the fever the very first day, we cannot get this contained yet.
Well, and the public now being urged to practice social distancing, but many still ignoring that call. How does one strike the balance of being socially responsible and living life?
Yeah, right now, a lot of businesses, I understand, are suffering. A lot of people have to reschedule their life. White-collar workers luckily have the ability to telework from home, but most workers are blue-collar hourly workers, and they actually are at tremendous risk. And the jobs like bartenders and at restaurants and waiters, they are having a really tough time along with the small businesses. We have to pay a small short-term gain for a long-term, short-term pain for a long-term gain in stopping this epidemic.
Doctor, how prepared is the medical community to receive an influx of patients should the situation worsen here?
Yeah, the U.S., we have very little slack capacity. If you ever try to get a hospital bed in a hospital in the U.S., it's very difficult because there's very few excess beds. And ICU beds are also limited. You know, what we have just realized is in Italy, instead of just 5% of people needing ICUs like in China, 16% of all patients who test positive need ICUs. That is an incredible number, and the mortality in Lombardy is around 8%. We're just realizing potentially we need 3-fold as many ICUs as even China did, because this virus is just so infectious and we're catching it so late. And the later you catch it, the more hospital beds and ICUs we need. This is why we have to slow down the epidemic with social distancing and containment as much as we can. Because until we have a vaccine 1 year, 1.5 years from now, we're not going to be able to stop it otherwise without social distancing.
Well, the World Health Organization calls Europe the center of the epidemic now. It's got more deaths a day than China did at the height of its outbreak.
Yeah.
Is there a fear that the epidemic might accelerate in other regions?
Yeah, this is the serious danger. Right now, all these European countries plus the U.S. Are having exponential growth of approximately 30 to 35% per day. That's multiplying it out. It's exponentially. Other countries like Africa are even less prepared. Latin America, even less prepared because they even have less hospital resources and less ready and able funded healthcare systems. If the most funded healthcare system in the world, advanced in a world like Europe, can't handle it, the rest of the world, that's going to be even bad sign.
Thank you so much, Dr. Feigl-Ding from the Federation of American Scientists, for your time and insight.